So you're at that point, you're trying to decide, okay, I have low dopamine levels. I get that. But how can I actually increase them naturally without necessarily having to use a medication? So we're going to talk about that right after this intro. How you doing, my optimal mind? Today we're going to be talking about how can you increase your dopamine levels naturally. Now, if you are somebody that has low dopamine levels because whether you were told because you have ADHD, whether you have depression, anxiety, or you have trouble focusing or paying attention, if you're in that kind of category or you forget things and you can't remember things, chances are that you can have low dopamine levels. So we're going to talk about that. But before we get started, if you are new here and actually do have ADHD and are trying to look for better ways to improve your ADHD naturally, well, I also have a free guide in the description below. Basically goes over the labs that you should be running if you have ADHD, what supplements and nutrients you can implement, what foods to implement, as well as what foods to avoid. All that is in the description below for adults with ADHD as well as parents who have kids with ADHD. So enough about that. So let's talk about first dopamine, what that actually means having low dopamine. So like I mentioned before, these people who do have low dopamine levels can either have ADHD, depression, have trouble focusing, forget all the time, remembering, can have anxiety. There's lots of symptoms that can be associated with basically having low dopamine levels. And so dopamine is a neurotransmitter, basically a chemical that our brain produces, and it's also throughout our entire body. So neurotransmitters are throughout our entire body, so we can see low levels throughout our body as well. But what we need to really realize before you go and try any of, the things that, as far as what supplements and other natural things that you can implement to increase dopamine levels, you first need to test to see if you do have low dopamine levels in the first place. You do need to see if there's other imbalances in your neurotransmitters, and you can certainly test that. Something that I do at my own place, my own practice, and what I do with my own patients is to see where there's imbalances, because it could be more than just low dopamine. It could be other things that are imbalanced, such as serotonin, norepinephrine, epinephrine, just to name a few neurotransmitters. And so it's really, really critical to first do some testing to see what's in balance, okay? So first and foremost, you do just need to check before you try anything of these things that I suggest, okay? Check with your doctor first, as always, especially if you're on medications, because a lot of these medications can interact, and if they're not done correctly, you can run into some problems. So when we talk about dopamine, what becomes a problem is usually the nutrients that does help and provide basically building dopamine. Okay, and I've talked about this in some of my other, videos talking about neurotropics. But let's talk about a few things as far as some herbs as well as some other types of nutrients that can help contribute to dopamine. So just to name a few, N-acetyl L-tyrosine is one, rhodiola, which is an herb that can actually help contribute and does help with increased dopamine levels. And also mucuna prurins, which is an Ayurvedic type of herb that you can use that has been shown that has some small levels of L-dopa in it. Now, L-dopa is a precursor to dopamine to be able to actually help improve levels of dopamine. And they've found in that actually particular herb, it can help, does have L-dopa in it. Another one is L-theanine. So L-theanine has been shown to increase levels of dopamine. So these are just a few that do help make the dopamine. It's that process that if you do have low levels of dopamine, you can certainly try using some of these different herbs and different types of aminos and different types of supplements that can help build those factors if you have low levels of dopamine. Now, going a step further upon that, sometimes it's the cofactors. So a cofactor is usually what helps convert basically the process of making dopamine. So that cofactor, the process of making dopamine, so like I mentioned before, L-dopa is the precursor to dopamine, and then from L-dopa is tyrosine. So it has a step process, and in between that, actually converting it, you have to use enzymes, and then of course cofactors that help with that process of breaking it down, creating the dopamine, and so forth. And then of course dopamine then makes norepinephrine, epinephrine, and those are very important. Also neurotransmitters in our body when they're imbalanced that can contribute to people who have anxiety or depression or ADHD or having trouble focusing and remembering these things. So taking that step further, talking about cofactors, there's certain types of nutrients that are key to actually have those cofactors to help break down that process from L-Dopa to dopamine. So just to name some important nutrients, some important cofactors would be vitamin D, vitamin B4 and B3, zinc, as well as SAM-E, just to name a few, and also vitamin C. These are certain cofactors that are really critical. Now, to know if you need these, you need, again, run these tests. There's a neurotransmitter test to be able to actually check your neurotransmitter levels to see if there's actually imbalances going on. Now, if there's not, I wouldn't be sitting there and experimenting to see, okay, let's try this type of supplements, let's increase this. It could eventually lead to be more damaging than good. That's why you always need to check with your doctor first and to see if you do have these imbalances. And that's something that I do, like I mentioned before, something that I always do with my patients or my clients that I work with who have trouble with focusing and paying attention or are dealing with ADHD, or maybe they think they have ADHD or even have anxiety or depression. So these are things that are really kind of crucial to be able to see before you actually implement a treatment plan. Because when you do this, then you actually can see how natural medicine can be beneficial. When you don't do this and you just are testing whatever, you're going to find natural medicine not working for helping increasing your levels of dopamine. And that's why you got to be careful with this. And if you really want natural medicine to be effective, first do the testing first. So I hope you found this beneficial. And before you go, if you want to know more information as far as what types of nutrients to implement for ADHD, as well as what labs to run for ADHD, as well as what foods to avoid and foods to implement, I have a free downloadable guide in the description below, one for adults as well as for parents who have kids with ADHD. So until next time, this is Dr. Legrand, and remember, you have an optimal mind. Thanks. Bye.